So let me introduce myself. I'm Dr. Judith Pence, and I'm a faculty member here at UNM, associate professor in psychiatry, and have an interest in integrative medicine. And in fact, that's how Noshene and I know each other, is in that realm. And since 2018, I've been the program director for an elective that's available to child fellows, to other fellows as well, if they have an interest, and second and third and fourth year residents. This is a year-long elective that meets pretty much every Tuesday, and we cover many, many topics in that time. But you also have a connection then to the University of Arizona's online curriculum that is now focused overarching on integrative medicine. There isn't a separate track for psychiatry anymore. So I just wanted to mention that. And there's been some research done, which is what Noshene will be sharing with us today. And let me allow myself to read the introduction, and I'll turn the stage over to Noshene. So Dr. Ranjbar was born and raised in Tehran, Iran, until immigrating to the US in her adolescence. Dr. Noshene Ranjbar developed a passion for a holistic view of medicine and healing from an early on time in her life. Throughout her studies and life experiences, including her own illness, as well as caring for her mom, who had several autoimmune illnesses and cancer, to fostering refugee children with PTSD, working with the American Indian communities across the U.S., she has developed a keen interest in approaches to healing trauma, advocating for holistic mental health in empowering, culturally appropriate ways. Dr. Ranjbar completed undergrad and medical school at the University of Virginia, followed by family medicine internship at Middlesex Hartford Hospital, and psychiatric residency at the University of Arizona-Tucson, as well as her child and adolescent psychiatry fellowship at Boston Children's Harvard Medical School. She's board certified in general psychiatry, child and adolescent, as well as integrative medicine. She currently serves as an associate professor of psychiatry and the director of integrative psychiatry program at the University of Arizona. She also serves on the faculty with the Center for Mind and Body Medicine, the Andrew Weil Center for Integrative Medicine, and the Integrative Psychiatry Institute. Her research focuses on training the next generation of psychiatrists to offer a holistic approach to mental health while serving children and families most in need. As a Robert Wood Johnson Culture of Health leader, she is expanding her work in integrative mental health, indigenous mental health, nationally and internationally. Please, Dr. Ranjbar, the stage is yours.
Thank you so much, Dr. Pence. It's an honor to be back at the University of New Mexico, at least virtually. We were just talking how I was there about 7 or 8 years ago to present grand rounds in person, and I hope to return and visit your beautiful, enchanted land. So without further ado, here are my disclosures. As Dr. Pence mentioned, that I teach and serve faculty and receive honoraria from different places, including the Andrew Weil Center for Integrative Medicine and the Center for Mind-Body Medicine, both of which are nonprofit institutions, as well as the Integrative Psychiatry Institute. So, and also just so you know, we have about a 40-minute or so, 45-minute time for me to speak. And then I would really like to open the floor up for discussion and questions. If you have urgent things to say, feel free to ask them in the middle of the presentation. Otherwise, we'll address them at the end. So the objectives are to summarize basic principles of integrative psychiatry, review a training program that has been developed about 10 years ago, and how the results of the evaluation that we have done at the University of Arizona discuss training opportunities nationally and internationally for psychiatry residents and fellows and faculty, to enhance patient care, physician well-being, cultural humility, and advocacy for our patients. So, as Dr. Pence mentioned, I've had a little bit of a tortuous path to practicing integrative psychiatry and teaching now. And just a quick overview, as she mentioned, I was born and raised in Iran, and I grew up experiencing medicine in a multifaceted, holistic way because of my mom's illness. This is me as a 4-year-old, and she suffered from chronic pain and lupus and scleroderma and rheumatoid arthritis, and it was just the two of us living together. So I remember following her around to the acupuncturist and to the herbalist and to the regular doctor and to the pharmacist and to the apothecary and to mindfulness, chanting, spiritual things. And so I really grew up seeing healing as having a lot of different facets, and then, the Iran-Iraq War happened, and I was one of the uh, one of the children impacted by kind of living in a society where there's a lot of oppression and wars and trauma and unmet needs. And then when I moved to the U.S. To Virginia, and was lucky to get into college and then medical school at the University of Virginia, and I began to study medicine, I realized that what was taught to us was just a sliver of the incredible field of healing and medicine that I had thought that existed. So it's a little bit of a disappointing reality check, and there was a group of us medical students at the time who had interest in this more comprehensive way of looking at human health, and we would meet in a like underground in the medical school and have our bag lunches and dream about how someday medical school would be different and we'd be taught many different things beside, what was at that time in the curriculum. And so anyway, that was 25 years ago. And oh, I forgot to mention, this is the last little apartment I lived in Iran. And I've never been back in 35 years. So I finished medical school, and I started family medicine residency, and soon started to experience extreme burnout and anxiety myself. And unbeknownst to me, I had had all kinds of experiences I had never had a chance to process as a young person. And all of that, I think, was catching up to me when I was an intern on Q4 calls and not getting enough sleep and not eating well and having all kinds of other stresses. And so that's when my healing journey actually started, when I had to leave my internship program in family medicine with a lot of shame and, wondering what was wrong with me due to burnout and anxiety and depression. And that actually started this venture into reclaiming my health, but also getting exposed to how psychiatry is practiced, how at that time it was not really culturally congruent, trauma informed, at least in my experience. I also ended up with 3 foster kids, all with PTSD from Afghanistan, and as a foster mom, trying to get them help. This is after I left my internship in family medicine and started to do some of my own healing work. I realized that the system and the psychology people who were trying to help were not really trained to care for these children the way that they needed to. So all of that brought me eventually to return to residency years later in psychiatry here at the University of Arizona. And then the Gabby Giffords shooting happened while I was here, and that started this whole journey of figuring out how one-on-one patient enough full of trauma that our society is experiencing. And that's when I was introduced to the Center for Mind Body Medicine, where there's large scale programs and population-wide train the trainer model. And I was able to incorporate that a little bit into my work as a resident when the Gabby Giffords shooting happened. Fast forward, I went to Boston, and the Boston Marathon bombing happened while I was there as a child psychiatry fellow. And again, I happened to be in the right time in the right place, or in the wrong time in the wrong place, to be able to bring some of what I had learned, especially through this train the trainer model of mind-body medicine, being one aspect of integrative psychiatry, to support the Boston public schools in the midst of the trauma that was going on with the aftermath of the marathon bombing. And then eventually things took me to Pine Ridge Reservation and working with tribal communities, now with about 30 different tribal communities, again, using this more holistic, integrative model while teaching residents and fellows and the next generation of psychiatrists and mental health professionals how to both take better care of ourselves for our own mental health and burnout and sustainability of our work, but also how to bring it to communities that we love and are part of or wanting to support. And it has all brought me back to working with my fellow Iranians and Farsi speaking people. And thanks to those of you who are here from that background as well. So I know this was a long story, but I feel like it's important for you to know the perspective that I bring to this field and why I do this research and what I want to make available to you all and, to others you might know around the country or around the world who are interested in joining this movement towards a more comprehensive mental health care that is not really new. It's reclaiming our wholeness as human beings, both as physicians and providers and practitioners and therapists and counselors, but also being able to meet people where they're at and supporting them in comprehensive, holistic, culturally congruent, trauma-informed ways that they deserve to be treated with. So integrative medicine, as far as um, definitions go, is an approach to medical care, to medicine, to healing that is focused on strengths, focused on the healing journey, not so much focused on not prioritizing the disease process and what's wrong, but really looking at the whole person and being able to incorporate their strengths and healing capacity in the healing journey as a priority. It takes into account the mind, the body, the emotions, the spirit, the environment, the culture, and we'll talk a little bit more about that. It emphasizes the relationship more than anything else, of trust, of safety, of building a relationship between one human and another, a part that AI will not be able to quite do justice with. It is informed by evidence, so not hearsay, and this might be a good idea, but things that have been practiced for thousands of years, and now we have scientific evidence to show a little bit more about why they were so important to human resiliency for tribes and indigenous people all over the world, and why some of the reasons why they worked. Even though our science has advanced so far, there's still so much we don't know, but that we are understanding more and more about the mechanisms of action of aspects of what are now called integrative medicine that have been around forever, but our Western scientific method medical school curriculum has never really incorporated them into it itself, and is doing that more and more so in the past 20 years. And therefore, by having this bigger perspective, knowing the research, knowing the safety benefits, to be able to make use of many, many appropriate therapies given the person's belief system, interests, access, where they live, what they prefer, and kind of meet them where they're at, connect them to the community of resources that they might be part of. And so it really requires a partnership. It's a collaborative effort. It uses evidence-based aspects of integrative medicine to facilitate the mind and the body and the spirit's inherent capacity to heal and recover. So it's hopeful. It's hopeful medicine. It's good medicine. It doesn't reject conventional medicine. It doesn't embrace uncritical alternative things. So it's sustainable, foundational, scientifically sound medicine. Um, it's based on science, inquiry-driven, and open to new paradigms. It considers all factors that influence health, from what's in our water to how our environment pollutions may be impacting us, to our screen time, to our cultural belief systems and practices, to our all different aspects of what makes us either more healthy or struggling more and more. And it focuses on promoting health and preventing illness so that our healthcare dollars go much more towards how to teach people how to take better care of themselves and their communities on a grassroots effort, so that the incredible amount of waste, I would say, that happens when people are not educated and then they have to go towards high interventions and hospitalization frequently. It really wastes a lot of resources. So it really brings the treatment, the prevention back to the community, to the person, to the family. And you might be wondering um, why there's interest in this. Like, why should we even bother teaching these things in medical schools or residency? And we'll get to that, and why the research is important. Partly it's because people are using all kinds of things, whether it's nutritional supplements, whether it's yoga classes or chiropractors or osteopathic manipulation or meditations or mind-body groups or Ayurveda or traditional Chinese medicine. People are using these things, but much of the time they don't know what's safe and what's not. They don't know how to find referrals and how to spend money wisely, and they don't share with their doctor because their doctor was never trained in any of this. So the doctor is not necessarily the safest person to come to and ask questions. And so there's a lot of safety issues there, because a lot of times people might be taking things, especially because they're not uh, safety tested and necessarily an easy place for anybody to look up on Google, what kind of magnesium should I be taking? And they might end up taking something that has pollutants in it and they wouldn't know. Or it could be that they're taking a fish oil supplement that has a bunch of mercury in it and they wouldn't know any different. Or they could be going to some practitioner that, God forbid, is not practicing it with the best ethics, which could be true in conventional medicine as well. But there's a lot of safety issues, medical, drug supplement interactions, money potentially wasted, but it's all partly because of this lack or gap between medical education and what is out there for people to access. And then lastly, as our world gets smaller and our communities are demanding a more decolonized approach to medicine, a less hierarchical top-down, where your doctor tells you what to do and what's wrong with you, and no questions allowed, to one that really appreciates and takes into account each person's heritage, culture, strengths, belief system, background, access, ability to incorporate various medications or other treatments that might be options. And so the need for us as physicians, as practitioners, to be educated and aware so that we can provide something that is cutting edge and updated for what the person needs is more than ever before. And if you think about the the various aspects of our health. Of course, there's the individual factors of our genetics and experience and our mind, body, emotion, spirit, health. Then there is the social aspects. We learned a lot about this during the COVID pandemic, where the isolation was extreme and so much loss and grief. So our interpersonal social relations. Then there's the built structure, both physical and other aspects of our environment, the community we live in, the natural environment we have where we don't have access to, the organizations and institutions and policy and system that impacts us. And then there is, on the much larger level, the cultural aspects of how we were raised, what our belief system and values are, our traditions, our language, our history. And so all of that ends up impacting how we experience health and disease and what we expect how that healing journey can look and some of the challenges there. And so all of those things need to be taken into account. So there's so much to say about this, so I appreciate your patience. When we started creating the integrative medicine curriculum for psychiatry residents, because the integrative medicine curriculum, various types of it have been out there for family medicine doctors and pediatricians and internal medicine doctors. But we had, to our knowledge, there had never been a systematized evidence-based integrative psychiatry curriculum for psychiatry residents, faculty, medical students, et cetera. And so we started, this was in 2015, 2016, we started with this needs assessment of program directors and faculty at various institutions in the US. And we, asked them questions of what do you have available at your institution about different aspects of what is integrative medicine for your psychiatry residents, for your fellows. And what they told us was we had 36 respondents in that survey. And about 50% indicated that they currently had some sort of integrative medicine content in their curriculum. But only 11% said that the program that they had was sufficient. And the content areas that were most highly rated for that would be good to included things on sleep health, motivational interviewing, self-care. The respondents also indicated that incorporating integrative medicine to psychiatry training curriculum or as an elective would be desirable. About 47% thought it would be great to include it for everyone, all residents to learn, and about 44% thought it would be good as an elective. And about 67% thought that on-site based experiential activities demonstrating various aspects of integrative medicine, so whether it's nutrition or mind-body medicine or different aspects would be important. And 58% said that it would be good to have online modules supplemented by local activity as the most desirable learning methods. So either have it kind of all on site or have it with modules and then have additional support on site. And the significant barriers that these program directors and faculty listed as why they haven't brought something like this to their program were time constraints, of course, lack of faculty expertise in integrative medicine topics, current lack of curricular requirements for much of what integrative medicine competencies at that time anyway incorporated, and budgetary limitations. So based on that, and then there's this other research that was done in 2021, which is fascinating, much about the nutritional piece of integrative psychiatry, it's referred to as nutritional psychiatry. And in this study, which was a global survey across 52 countries, found that mental health professionals, including psychiatrists, psychologists, and psychotherapists, had poor nutritional literacy, with most reporting little or no formal training in nutrition. 14% rated their education as very low, and only 0.8% rated their education and nutritional mental health as very high. And on average, clinicians rated themselves as on a 10-point scale at a 3.9 when asked to rate their level of education on nutrition. And despite this, many still recommend dietary strategies and supplements to their patients, highlighting a gap between education and training and what is needed to provide out in the world. The other piece of this is that there were 354 psychiatrist participants in this research, and 155% of them responded to the question of whether they had specific training in nutritional care. 74% reported no lectures, no access ever to any of this material in their training, and 15% had some training during their medical school. And 8% said they had electives on this topic. And a minority of participants, an N of 4, had obligatory courses in nutrition. And those were one in Lithuania, one in Switzerland, one in the UK, and one in the US. And I just find this fascinating as, you know, this field continues to expand significantly over time. And part of all this is, of course, the trauma-informed care and cultural humility. That's also part of the training needed for mental health care to be made accessible to minoritized communities and underrepresented communities, whether it's tribal communities, whether it's immigrants and refugees, whether it's people who don't speak the language of the land, in this case, English. And so there's a lot of work needed in that respect as well. And the reason that this part is very important as part of integrative medicine education is that a lot of what we now know in integrative medicine to be effective actually has its roots in a lot of these incredible cultures. And yet our current healthcare system, a lot of times, hasn't figured out how to meet the needs of these communities because there's a little bit of a gap between what the community believes, what their strengths and roots are, and what is provided as medical care. And so a lot of people don't trust the healthcare system, or they don't see it as empowering and celebrating their perspectives and cultural richness, et cetera. And so integrative medicine and integrative psychiatry is actually a really great opportunity to bridge these gaps for communities that otherwise would not seek mental health care or physical health care for that matter. And so coming more to this particular curriculum, integrative medicine and residency for psychiatrists, development over time, the goals have been to improve resident knowledge of evidence-based integrative psychiatry, improve resident wellness and self-awareness of our own healing earlier on in our career journey as residents, and incorporate knowledge of evidence-based integrative psychiatry into the clinical setting. Part of that for our program has been mind-body skills groups, which at the University of Arizona have been offered to residents starting in 2015. And initially, it was a component of the integrative psychiatry program and started as an elective where PGY3s and PGY4s could elect to participate in these like 10-week groups. But after 2 or 3 years, the program directors asked us if we could make it mandatory for all interns in July and August of their internship. And so ever since then, every psychiatry resident at the University of Arizona College of Medicine, Tucson, goes through a mind-body group as a cohort of 12. We have 12 PGY1s in our residency. And that becomes the safe space, inner work, self-awareness kind of journey that sets the stage for the rest of the residency curriculum and planning. And it's part of the didactics, which is why it's really become easy to implement. You can see this academic psychiatry publication that talked about what we found when we surveyed these residents, 44 residents from 2018 to 2020 about their experience going through these groups, and how, the skills that they learned, how they used some of these with their patients, how it brought them closer together as a cohort, and also gave them tools to deal with their own stress and burnout. And then the most recent publication that we have had, looking at 4 years of data of the evaluation of this curriculum, which I'll talk more about and happy to answer questions, just came out, I think, a couple months ago, in academic psychiatry. And basically, it assessed results of resident surveys and medical knowledge tests that the residents went through. And they were PGY3 and PGY4 residents, again, at the University of Arizona College of Medicine, Tucson, as well as several child psychiatry fellows. Between 2015 and 2018, there's a written in this slide, that there was time allotted in the training curriculum by the program directors to complete the elective for these residents. It was presented as an elective. They received a certificate of completion co-sponsored by the Department of Psychiatry and the Andrew Weil Center for Integrative Medicine if they attended 70% or more of the in-person experiential sessions, and if they completed more than 80% or more of the online curriculum, which is about 100 hours, and then passed the final medical knowledge test. So the objectives of this research was to describe the knowledge change, self-assess confidence in providing integrative medicine approach to psychiatric patients, and the residents' and fellows' perspective on the value and feasibility of the curriculum during the residency or fellowship experience. The methods, we used pre-post medical knowledge tests. So we gave approximately 40 question test at the very beginning of the year. And then again, at the end of the year, it was the same test to all the residents and the fellows. And then we also gave them self-assessment instruments to track their own sense of confidence. How confident are you to talk about or to answer your patient's question about nutrition? How confident are you to answer your patient's question about where do they buy the supplement, and a variety of different things. And then we also did a semi-structured interview with these residents at the end of the curriculum program completion to understand some of their perspectives and what worked for them and what could be improved. And so the results included that 35 of the 37 participants completed the elective over that 4-year period. The self-assessment items with the greatest positive pre-post change were ability to identify authoritative sources about botanicals, effectively respond to patients' questions regarding use of herbs and supplements, and interpret labels on nutraceuticals. In addition, the results demonstrated that the mean score on the medical knowledge test for the 30 who completed both the pre and the post went from 64% right answers to 81% from the beginning of the year to the end of the year. And the self-assessed confidence in providing this integrative approach to address 18 common medical and psychiatric conditions all increased with a P less than 0.001. Also, the interviews, all participants highly recommended the curriculum, found it feasible to complete during their training. Here is some of the self-assessment of the knowledge questions, like I'm aware of different physical activity recommendations for kids and adolescents, for example, or I know how to take a spiritual history, or I know the fundamental components of an anti-inflammatory diet, or I know how to facilitate a patient's efforts on changing their behaviors. I know how to assess a patient's readiness to change their behaviors. Questions like that. And then the self-assessment of the integrative medicine skills for medical conditions were all things from irritable bowel syndrome to bipolar disorder to autism spectrum to ADHD, PMDD, etc. So the key discussion points in all of this, I should go back for just a second so you can see some of the pre-post changes and the Cohen's D's and how it's about 30 to 31 people who responded to this questionnaire. So some of the key discussion points are that there is a curricular gap in psychiatry residency training on nutritional interventions. We know that both from the research I mentioned, but also based on certainly my own experience going through medical school and residency and fellowship here in the US. Despite strong literature base to support the use of mindfulness, all kinds of different mind-body practices in psychiatry residency education to reduce burnout and improve patient care, many residency programs lack sufficient content in this area. Modest yet significant gain in the pre-post medical knowledge, despite a small sample size, suggests that the curriculum increased the baseline IM knowledge for this group of residents. In addition, there is benefit seen across multiple domains, including self-rated confidence in treating various disorders from an integrative lens, and qualitative reports of applying this knowledge for participants' own health and well-being. It's vital for psychiatrists to receive baseline competency in evaluating the appropriateness and potential risks of various approaches to ensure optimal patient care and avoid potential harm, especially things like medication supplement interactions and unnecessary costs that can harm our patients. Some of the limitations of this research include that it was a relatively small sample size from a single institution, and we did not have a control group. One of the main reasons why it was challenging to get other institutions to also do research was the various IRB requirements at various institutions for their residents, which we'll come to in just a moment. Participants self-selected to complete our curriculum. It was an elective. We have to say it was a pretty popular elective, but nonetheless, it was an elective, and the core content of the online curriculum remained largely unchanged. But as you'll see when I go over what the curriculum entails, it does get updated every 2 years to reflect the latest research because the research continues to expand so rapidly. And our curriculum has been an iterative design. So every year, based on those interviews and feedback from the residents from the last year, we have changed and made adjustments to meet, to try to improve based on and their feedback. So that 5-year period did not have the exact same everything due to slight variations in the mostly experiential component. So as far as future directions go, we need larger, more diverse samples from multiple institutions to validate the results and assess the generalizability of this curriculum's effectiveness across various training programs and settings. We need to include additional measures of resident competency, such as evaluation by faculty supervisors, patient feedback, patient care outcomes, and healthcare cost savings. And in conclusion, the IMR curriculum provides trainee skills that promote comprehensive person-centered care. It's a tool to optimize patient care and safety while enhancing physician well-being. Wider spread incorporation of the curriculum can be helpful for psychiatry residency programs that are interested. And I'd like to then end with training opportunities. So you know what's out there, whether you are at UNM, you already have access to this. And if you are watching from any other institution, you can see what's available. So the Integrative Psychiatry program kind of is housed at the University of Arizona College of Medicine, Tucson, but then there is a virtual elective that's available to any resident or fellow in psychiatry anywhere in the world. So that allows them, even if they're not at an institution like UNM that has their own site and their own faculty to teach and support them, they can participate through our program at the University of Arizona, and it's fully virtual. So we have people from Turkey and India and Nepal and Portugal and Germany and many other places, in addition to multiple programs here in the US, whose residents come and do this program with us. The program offerings are also, a lot of aspects of it are available for the public. So the IMR curriculum, which I'll show you what the content is a little bit, but also we have monthly Zoom meetings that are second Friday of every month at noon Central. And any resident, medical student, faculty can get on this listserv and be able to be added to the invitations for the monthly Zoom meetings, where every time an expert presentation is offered, and there's Q&A, and we all get to know each other. And those presentations are kept in our YouTube playlist. I put a QR code if you're interested in looking at those. I think there's about 40 different brief presentations that are all on various aspects of integrative psychiatry. But they are from these monthly meetings. There are faculty development opportunities, both virtual and in person, with a faculty development retreat every March or April in Tucson for all the site directors from all the sites nationally. There are opportunities to be connected with facilitators around the country who can facilitate mind-body groups for the residents if the faculty don't already have someone in mind that can facilitate that kind of experiential for the residents. There are many scholarly activity opportunities, professional training in mind-body medicine. That's just one of the many places that training can be done. There's an integrative psychiatry Facebook group that's for MDs and DOs only. And then there's another one that also includes PhDs and nurse practitioners, et cetera. So if you are in any of those groups, you're welcome to become part of those. The actual IMR, Integrative Medicine and Residency curriculum, which has changed the exact number of hours and the exact content over the years, is currently about 120 hours. And it includes everything from introductory materials to information about neural and mental health and motivational interviewing, healthcare professional well-being, mind-body medicine, nutritional aspects, dietary supplements, complementary approaches, clinical practice, and special topics, which include a lot of child and adolescent material. And so this is the piece that is easily that many residents at UNM over the years have completed under the direction of Dr. Pence, but that is the case at other residency programs as well. These are the IMR psychiatry training sites that we've had so far. So UNM, of course, was the first program to incorporate this after Tucson into their residency. University of South Florida, Des Moines Mercy Care residency program with Dr. Kang. South Florida is with Dr. Stock and Chris Kalibi. Southern Illinois University is with Dr. Kulia. Unity Point is with Dr. Dotson. Loyola University and the Heinz Junior VA in Chicago with Dr. Athoda. Zucker Hillside residency program in New York with Dr. Soman. And we continue to add sites as we meet new institutions who are interested in incorporating this. And last but not least are opportunities for getting board certified in integrative medicine, which certainly helps to advance the field in as much of an as much of an evidence-based way as possible. And so there's a fellowship you can do through various places like the Andrew Weil Center for Integrative Medicine or Psychiatry Redefined or the Integrative Psychiatry Institute. You can get certified in mind-body medicine through the Center for Mind-Body Medicine, as well as other places. Academic Consortium for Integrative Medicine and Health. You guys at UNM can be part of that because of if the hospital university is a member of the consortium, then any resident, any medical student, any faculty gets free membership from that institution as well. And the next meeting is coming up in Seattle in April, I believe. It's a wonderful resource for mentorship and scholarly work and getting to be part of the field. And then, and we also have a organic resources page off of our university website with many, many more resources as far as doctors and I'm sorry, books that have been authored by different experts in the field and different clinical educational opportunities and seminars and a lot more apps and different things that you might find useful. Oops. And I want to really hear from all of you, but I want to give my special thanks to Dr. Pence for having me again to share with you all, in addition to some of my esteemed colleagues and mentors, including Dr. Villagomez, Dr. Raison, Dr. Kaplan, Dr. Rutledge, Dr. Gordon, and my partner, Matt Erb, who's always helping me with a lot of this. All the references from this presentation can be found in this Q&R code, and I am open to receive emails with comments and questions and feedback, but also would love to hear from you all live now.
I'm muted. Thank you. That was really a nice overview in terms of the growth that's happened. It started, what, in 2015 or 16, pretty much for you? Yes.
2015, yep.
Yeah, 2015. So there's two things. That last list was, I just wanted to let, it wasn't maybe as clear, maybe it was clear to others, but maybe not. That is a way for, if you're out of training, out of residency, a pathway for you to become an integrative practitioner with supervision. That's often included in the process. There's active supervision in terms of live as well as in person, and opportunities there for your own personal growth as a result of the journey. I also wanted to do a shout out to Dr. Towen, who is our chair. He has been most gracious in funding the program for us, for the trainees, and would like to let Dr. Towen know I've appreciated that support. And sometimes when we've gone over the quota, he has heard the requests from the trainees and responded accordingly. So I do want to recognize that I do get departmental support for the work that for this program.
Yes, without institutional support, none of this would have been possible at any of the institutions. So thank you, Dr. Towen.
Right. Yes. Thank you very much. Any questions that anyone has or comments? Certainly open. I wanted to do a shout out to Dr. Chavez. He actually helps towards the end of the elective, sharing his journey and the cultural impact of the work that he's doing, along with several of his colleagues in the community that have come. And we've actually expanded our conversation so that it's a 2-day conversation. And there's also been a standing invitation to go into the 2-week curandera course that is hosted here at the University of New Mexico, and that several of my trainees who've done it, no one has ever been disappointed. It's been an incredible experience for them, along with the experiential, component, whether they do Olympia or any other possibilities in terms of a healing opportunity. So that's just part of the curriculum of what we're teaching here at the University of New Mexico. So I did have one question, actually, in terms of the funding that you have for the mind-body group that you're doing at the University of Arizona. How are you funding that? Because I know it's not inexpensive to do that. And then I see we have a question by Joy. So I'll wait to have Joy speak. If you could respond to that, that would be great. Dr.
Sure.
Ranjbar.
Yeah. So funding is always the hardest part of all of this,
Right.
unless we're lucky and just know philanthropists who want to support enhancing education. So, so far we have been fortunate to submit grants to the Weil Foundation every year, which I think you guys received one year as well.
Yeah.
basically to allow us to add some of these experiential things, including the mind-body groups. We used to have an Ayurvedic practitioner come and, teach Ayurveda in person to everybody, and as well as like a nutritionist come and cook with the residents, etc. And I couldn't do it all, so to be able to provide honoraria to these amazing people to come and enhance has been a gift, and we haven't always had that. As much of a fun to be able to have as many things. So now all we have is the mind body group. And up until now, it has been grant funded. However, we just found out that Banner Health, that is the institution under which the University of Arizona Medical Services are offered, is in the process of agreeing, or might have even agreed to incorporate enough fund for residents to always receive the mind body group, as part of the department. So if that
Mhm.
actually happens, then we don't have to write grant for that every year.
Mhm.
It seems like a small thing to ask, but it can. So I think as burnout becomes more of an issue, as absenteeism and, just how hard it is when staffing is not there becomes more and more monetized in the view of the funders and the institutions out there. I think the pitch for them to support things that facilitate well-being and, are part of the curriculum, so people are not told to go, spend more time outside of their work to do this wellness stuff, which no one likes to do. Like all of those things really help shift the culture that, we really need to be to be able to do our work. So those are some of the things we found, and also some of what we've been told is that, being able to go give a presentation at your local Rotary Club, or, any place that has little pockets of funds and cares about psychiatry, mental health, patient care, these different things, can be a
Mhm.
good way to supplement your curriculum with various things that might be useful for your particular program.
Okay, thank you.
Joy.
Joy.
Yes, thank you for this presentation. I have to say it's really exciting to see the opportunities and what you're doing at U of A. And so I sort of ended up with two questions. So one, I was just curious if you're familiar with ISTDP and your thoughts on it. If you are, because I think of that as a therapy modality that really is effective for physical complaints. So I was curious if you were familiar with that and your thoughts on that modality. And then the second question, I was just curious how integrative psychiatry maybe differs from integrative medicine, because I think the goal is to integrate mind and body. And so I was just kind of just puzzling over that a bit, like how integrative psychiatry might differ from the other integrative offerings that are out there.
So can you tell us what those initials stand for those who may not know?
Yes. Okay, can I do it? It's intensive short-term dynamic psychotherapy.
I thought, okay,
Thank you.
thank you.
And Joy, who are you? What do you do?
Yes, absolutely. So I'm a psychiatrist. I'm actually with Indian Health Services. Yeah.
Wonderful. Great. Okay. So I love ISTDP. I have to say, I usually hear that about ISTDP from all the Farsi speaking Iranians who are doing the mind body work with us, because almost like half of them are trained in ISTDP, and they incorporate a lot of what they learn in mind body medicine and vice versa into their work as psychologists. So I'm not trained in ISTDP, but there are many therapies under this umbrella of integrative medicine or psychiatry that I think it's great. Nobody can do them all, so it's good to have niches of what we're good at and what we find really speaks to us individually as practitioners. And there is no difference between integrative medicine and integrative psychiatry. It's just that if you do an integrative medicine fellowship, for example, that's 2 years at like the Andrew Weil Center, you have to learn everything: colon cancer, dermatology, cardiac. And as psychiatrists, we just don't have, most of us don't have the bandwidth to be good at everything. So it's basically taking the best of integrative medicine as it applies for mental health. And of some of that is obesity medicine, and some of that is, sleep and lifestyle and nutrition. But at least we're trying to limit it to what a psychiatrist really, really, really should know. Great question.
Yeah, it was a great question. Yes. All
Other
right.
comments?
We're close to the hour here. You and I can hang, and if people, still have questions. Also, don't forget about the QR code. If you are looking to sign in to get some continuing ed, please do that. And then there's a survey that's also a part of that process. So thank you for your time today, and thank you, Dr. Ranjbar.
I want to give a shout out to Thomas Chavez. You guys have incredible gifted faculty. I have had the honor of presenting with Dr. Chavez, and the curandero course, the curanderismo course, and the richness of the tribal communities that you are living amongst. Like that is the essence of holistic, culturally appropriate care for your people in New Mexico. So just it's so beautiful to be able to really bring what the land and the culture that you're practicing in has to offer versus, us bringing something from the outside. So thank
Right.
A pleasure to see you again, Noshene, and I can't wait to see you again and co-present again.
you. Absolutely. Brandon, did you want to, or Natalie, I'm so happy to actually see your faces. So if you have a comment or a question, and then Ms. Tavakwali, who's also here.
Yeah, I wanted
I
to
was just
say
going to say,
thank you.
oh,
Yeah.
go ahead.
Go ahead. I just want to say thank you for the invitation. It was wonderful information. And, I love, of course, mind-body medicine since I've been involved in mind-body medicine. And I do the same thing in psychotherapy, trying to look at people as a whole. And so that was very good information to add on to what I know. Thank you. It always is a pleasure to work with you, Noshene.
Thank you. Shaheen is my sister in Texas who does the work with Iranians and Farsi-speaking people through Mind Body Medicine. Brandon, all yours.
I just wanted to say thank you as well. I did IMER in med school, and I think this has just like re-inspired a lot of that. So I really appreciate you coming to talk to us. So thanks.
Great.
Brandon,
How
where
far
are you
along are
located?
you?
Yeah, sorry.
I'm a first year at UNM.
Oh, okay.
So yeah.
Okay. Great.
Great. Natalie, anything you want to say? No.
I just want to thank you for the presentation.
Pleasure. Feel free to stay in touch. I put my email there. I'm very approachable, and wish you all well wherever you are and wherever you are in your training. Thank you, Dr. Pence.
Yes, you're most welcome. Thank you all for coming today. Appreciate it.